We are at the site of the office building for the National Health Insurance Authority's office. You realize that this is a new place, still being worked on, but we can see that work has progressed very well. The building looks very nice. So the essence of it is just more like a site visit, because as the member of parliament, and for that matter, a member of the health committee in parliament, this structure is under our supervision to ensure that the work is finished in good time, quality work is done before it's handed over to the good people of Daffiama-Bussie-Issa. So you see that it is here at the district capital where our district hospital is. That is one of the basic requirements. It's supposed to be at the district capital, and we know that Issa is our district capital. But this structure you see is part, of the lobbying process that as member of parliament we're supposed to do. In the 2018 moving into 2019 budget, the NHIA had proposed to construct 10 offices across the region, for these districts without health insurance offices. And normally, they're supposed to meet the health committee to show us their budget for us to go through, make recommendations and inputs before it is finally approved by the General House. The House works in committees, but the final approval is done in-house where all the members are present, with the Speaker presiding. So it was at the consideration stage of the National Health Insurance formula, call it formula, that, when they said 10 offices were to be constructed, they didn't indicate these places, the places for these 10 offices. So, as members of the committee, those of us whose districts did not have offices started, to engage and to lobby to see whether some of us with pressing need for an office could be considered. So that is how come this place is here today, out of the lobbying process. And I remember I had to lobby through the then chairman, Dr. Kwabena Chumniema, who was the chairman of the committee, a classmate in the medical school, and I also met him in Parliament. So it was very easy to lobby and to talk. So he assured me that at least he was going to work through other stakeholders to see whether the Daffiama-Bussie-Issa district, based on the compelling and very reasonable arguments that I made, to be considered. So this place was considered as one of the offices, and that's how it started. And I want to be grateful to the CEO of the National Health Insurance Authority, to the chairman, for this office, because it will serve a very good purpose in helping us achieve universal health coverage. So I'm not here to take over the glory and say, oh, I built it. No. I appreciate the work of National Health Insurance Authority, but to show that it is out of the loving powers of your Member of Parliament, making very good and logical reasons as to why we need this office. And based on that, it was considered, the House approved, and that is the product we are seeing today. And our appeal to the CEO, we can see that it's complete. What is left is to finalize it and hand it over for us to use, including staff, so that good people, officers will be appointed to man this very good office. And I hope that in the shortest possible time, I pray that this office will be commissioned. And I hope I'll be around during the commissioning with the CEO and other stakeholders so that it will be commissioned and we hand it over to the district for use. I'm grateful.